Okay, hello everybody. Welcome to my multimedia presentation. Today I'm going to be talking about COVID-19 vaccines and potential ways that this might be relevant within the nutrition field and especially within maternal and child nutrition. So we all know COVID-19 coronavirus has been running rampant through society lately in a global pandemic. COVID-19 works by invading host cells and entering through endocytosis, mainly binding to our ACE2 receptors, which are prevalent in our nasal epithelium, and then translating to going further down the respiratory tract from there. So as of yesterday, we have an FDA-approved mRNA vaccine for COVID-19. And it works by providing our body with mRNA code to make a spike protein like the one present on the outside of the SARS-CoV-2 virus, which will then introduce into our body a spike protein without introducing COVID. And so that teaches the body to make antibodies that recognize this spike protein, such that when the virus invades, we will be able to recognize and attack it correctly. So nutrition is known to have a role in vaccine response, especially in several trials in developing countries where vitamin A is a concern. But we also have several different nutrients that are important for immune responses, right? So vitamin A, I'm going to be talking about most of the time today because of its responsibility in both adaptive and innate immunity. Firstly, vitamin A plays a huge role in our production of antibodies, growth and differentiation of B cells, and more importantly to COVID, the integrity of epithelia, including but not limited to respiratory epithelium. So going forward, I just want to touch on the relevance of vitamin A to maternal and child health. So as estimated by the World Health Organization, 19.1 million pregnant women worldwide are estimated to have low serum retinol, which is a status indicator of vitamin A. And then we also have 10 times that, 190 million estimated preschool age children worldwide are estimated to have low serum retinol, also according to the World Health Organization. And so this is important when we look at developing countries because vitamin A is important for so many aspects of the immune response. And luckily for us, this has been studied in different types of vaccination, different types of viral infections. So influenza vaccinations, for example, are not recommended for children under 6 months of age because of the introduction of the dead virus. So trials have looked at the efficacy of vaccinating mothers during pregnancy to allow the antibodies that are developed and that immunity to be passed on to the fetus. So one trial in Bangladesh actually found that this antenatal vaccination of influenza was 63% effective at preventing influenza in offspring as evidenced by laboratory tests. So we see that there is at least an efficacy of giving vaccinations during pregnancy and being able to protect offspring. Another study looked at a similar thing. So they looked at pandemic H1N1 vaccine response in mothers supplemented with vitamin A or with a placebo. And this is kind of common in developing countries. There's been several trials like this looking at vitamin A supplementation and vaccine response, antibody titers and such. So in this trial, both groups were able to significantly improve antibody levels for H1N1 in the mother. But more importantly, we saw a significantly higher antibody titer level at 6 months postpartum in the vitamin A supplemented mothers. And interestingly, the vaccination at less than 10 weeks of delivery showed significantly higher titers in influence from the placebo mothers. So there are some different nuances here, but we do see some improvement, at least in the mother's antibody response with vitamin A supplementation. Another study I think this was in a developed country, but they looked at oral vitamin A and vitamin D supplements because of kind of these different outcomes we're seeing in vitamin A supplementation trials with vaccination. So this study looked at both serum levels and supplementation in their modulation of immune response with pediatric flu vaccination. So this was luckily a randomized controlled trial, so it's a little bit higher quality evidence. And the children were vaccinated at the same time that they received 2,000 IUs of the retinol palmitate version of vitamin A and 2,000 IUs of vitamin D at both the 0 and 28-day flu shot. And so they saw that immune responses improved with supplementation, but only in kids that had either insufficient levels of retinol binding protein, which was an indicator of vitamin A status, or low vitamin D levels. So this goes to show that screening for nutrient status and seeing if kids or mothers possibly could have, seeing if they are sufficient in vitamin A or vitamin D could have a huge impact on vaccine response, at least in influenza. And so taking all of this with a grain of salt, because we don't yet have data in COVID-19 and the vaccinations barely hit the market yet, but I think this trend that we see in developing countries of vitamin A improving vaccine response, even if it's just by a little bit, should call attention to looking at nutrients and their impacts on vitamin A, on COVID vaccine response in both developed and developing countries. So first of all, monitoring the status of those receiving the vaccine and looking at antibody response sounds like a good first step, especially in these coming weeks and months as people begin to receive the vaccine. Secondly, clinical trials are needed in these countries that have high prevalence of vitamin A deficiency. And probably I would recommend to do research kind of like this few trials I covered here, looking at supplementation and COVID vaccination response. Because if you think about it, the COVID vaccine, even though it's an mRNA vaccine, still triggers our body to make antibodies, which we need vitamin A to do. And so if we are able to find evidence on this, on vitamin A or vitamin D and its modulation of vaccine response with COVID, it could greatly impact our overall potential for herd immunity worldwide. And so with more and more research coming, we should look into how the vitamin A status of mothers and their offspring could impact their ability to benefit from the COVID vaccine. There's a lot more research to do, but I think nutrition is a huge role, and having the means to make antibodies efficiently is going to prove very important in mitigating this pandemic. So thank you all. That's all for today.